Yes, you're doing it.
Yeah.
Hi, Claudia Manchanda, reporting from the local rosemary bush, and I was just saying that the flowers actually stopped a couple of weeks ago. They kind of dried out, and the fruits are coming, or the seeds. But if we look, there's some remnants of the flower, and when the plant is flowering is when the plant is most giving, and it's the best time to make the medicines and the essential oils through steam distillation. Right now we're going to focus on the neuroactive, psychostimulant and neuroprotective aspect of this plant, which is a huge element of rosemary. So drinking rosemary tea is anxiolytic. Anything with lytic means it cuts it. So spasmolytic, anxiolytic, analytic means to break something down. So if something's anxiolytic, it cuts down the severity of anxiety. It's also anti-nociceptive, which means it blocks the detection of pain and injury stimulus. So that's really useful if you've actually got a wound that's hurting, or you've got post-surgery pain, or you have neuralgia. It's a really useful property to have that. It actually blocks the signalling through sensory neurons. When there's high blood sugar, the term is hyperglycemia, nerve cells can die. It's called glucose-induced neuronal death. Rosemary inhibits this process through several mechanisms, including helping the uptake of glucose into cells and the uptake of fatty acids, but also stopping fatty oxidation, which occurs within the nervous system. Parkinson's disease is characterized by the physical loss of dopaminergic neurons in the substantia nigra, which are susceptible to free radical damage or free oxygen molecule damage. And rosemary extracts, especially the ones with the high flavonoids, inhibit this. Alzheimer's dementia is also associated with the loss of neurons, in this case cholinergic neurons, due to oxidative stress, something called excitatory stress or excitotoxicity, and the formation of amyloid plaques as a sort of defense response, and inflammatory cascades. This process is inhibited by rosemary extracts. Where have we heard about the words inflammatory cascades and cytokine storms? Yes, rosemary is anti-inflammatory and antiviral, and it inhibits COVID-19 viruses and cytokine storm phenomena. It also interferes with herpes simplex 1 and herpes simplex 2 and HIV. But obviously, if you're immunocompromised or these conditions affect you a lot, herbs alone might not cut it. But it's nice to know they have an added antiviral effect when you take them. The main classes of chemicals in rosemary are the flavonoids, tannic acids, and the bitter principles in the diterpenes and the volatile oils. The chemicals are broken down into monoterpenes, which are often the smelly components, the diterpenes, which are bitter, the phenolic acids, and the volatile oils. So the bitter diterpenes include arnosic acid, carnosol, and rosemol. The flavonoids include gentwarin and homoplugentine. The phenolic acids, rosmarinic acid, carnosic acid, and ursolic acid, and betulinic acid, and their derivatives are anti-inflammatory, antioxidant, and anti-tumour. The essential oil is preferred from the flowering tops, when the plant is manifesting and giving. Inhaling the essential oil of rosemary and lavender has been shown consistently to decrease cortisol levels. So here I am, and I have my lavender and my rosemary oil, and I'm going to inhale some to reduce my cortisol. I'm going to do a video soon on the ethics of essential oils, how they're made, and factors to consider if you're using them. And rosemary and lavender are two oils that I think are quite ethical to take if you're actually getting them from ethical sources, because they're sustainable. And lavender is very relaxing, and it's really lovely to have in baths, and rosemary is uplifting and antiviral. Should we get back to our vinegar?
Mm-hmm.